At 6:42 in the morning, federal agents surrounded a nursing home in a quiet suburban neighborhood where nothing was supposed to go wrong. No sirens, no warning, just a line of black SUVs parking along a street where elderly residents were still asleep in their beds, unaware that the building they called home was about to become the center of one of the largest healthcare fraud investigations in the region's history. Inside, night shift administrators were still finishing paperwork when the first agents came through the front doors. Within minutes, executives who had just arrived for the early shift were reaching for shredders, deleting files, and making frantic phone calls to lawyers who couldn't get there fast enough. Outside, federal agents were already moving in formation, warrants in hand, cameras rolling, sealing off exits before a single document could disappear. By the time the sun was fully up, 3 executives were in handcuffs, and investigators were hauling out box after box of falsified patient records that told a story of greed so calculated it would take auditors nearly 2 years to untangle it fully. This is the story of how a trusted chain of nursing homes turned vulnerable, dying patients into a $58 million profit machine, and how federal agents finally caught up with them. Hit that subscribe button and tap the bell icon, because we cover federal investigations like this one every single week. The chain operated under the name Willowbrook Senior Care Group, a network of nursing facilities spread across several counties, marketed to families as a place of comfort and dignity for aging parents and grandparents. On paper, Willowbrook looked like any other regional healthcare provider. Clean facilities, friendly staff, glowing reviews on their website, brochures with soft lighting and smiling seniors playing cards in sunlit common rooms. Families touring the facilities for the first time remember the same things: the smell of fresh coffee in the lobby, staff who knew every resident's name. It was, by every outward measure, exactly the kind of place you'd want for a parent who could no longer live alone. That impression mattered. A convincing front is what allows a scheme like this to survive as long as it does, because nobody questions a place that looks this good on the surface. But behind the scenes, something else was happening. Executives at the top of the organization had discovered a loophole a year earlier, and by the time investigators caught wind of it, they had been exploiting it with surgical precision for the better part of 4 years. Medicare, the federal health insurance program for elderly Americans, reimburses nursing facilities based on the level of care a patient requires. The sicker the patient, the more intensive the therapy, the higher the reimbursement. It's a system built entirely on trust, a system that assumes providers will report honestly, because the alternative, auditing every single claim in real time, simply isn't possible at a national scale. Willowbrook's leadership decided that honesty was optional. Court documents allege that administrators began systematically inflating patient diagnoses, adding conditions that didn't exist, and billing for therapy sessions that were never actually provided. In some of the most disturbing instances, according to investigators, sessions were billed for patients who had already passed away, sometimes weeks after their date of death. Physical therapy logs showed signatures from therapists who weren't even scheduled to work that day. Nursing notes described elaborate cognitive therapy sessions for dementia patients who, according to their own medical charts, had no diagnosed cognitive impairment whatsoever. It wasn't a single mistake. It wasn't one rogue employee cutting corners. Investigators say it was a system, engineered from the top down, designed to squeeze every possible dollar out of a program meant to protect the most vulnerable people in the country. And for years, it worked exactly as planned. The scheme might have continued indefinitely, if not for a billing coordinator, identified in court filings only as a cooperating witness. This employee had worked in medical billing for over a decade and knew, almost instinctively, when numbers didn't add up. According to federal filings, the coordinator noticed something troubling. Patients were being billed for what's called ultra-high therapy services, the most expensive reimbursement tier Medicare offers, even when their files showed they were barely mobile, some confined entirely to their beds, unable to participate in any meaningful physical therapy at all. At first, the coordinator assumed it was a clerical error. Billing systems are notoriously clunky, and mistakes happen constantly in an industry drowning in paperwork. But the pattern kept repeating. Week after week, the same handful of therapists were logged as providing hours of intensive treatment to patients who, according to nursing notes filed the very same day, hadn't left their beds. When the employee raised concerns internally, they were told, in no uncertain terms, to stay quiet and focus on their own department. When they pushed further, documenting their concerns in writing, they were quietly reassigned to a different facility entirely, effectively removed from the billing operation. That's when, according to court records, the employee began covertly saving documents, internal emails, billing spreadsheets, therapy logs, screenshots of scheduling systems that proved therapists couldn't have been in 2 places at once. Over the course of nearly a year, That employee built a paper trail that would eventually land in the hands of federal investigators. This is where two agencies entered the picture: the Federal Bureau of Investigation, which handles complex financial fraud on a national scale, and Homeland Security Investigations, whose Financial Crimes Unit specializes in tracing money laundering networks. Because Willowbrook's leadership wasn't just overbilling Medicare, they were funneling the profits through a web of shell companies specifically designed to obscure where the stolen money was actually going. If you're finding this story as unsettling as we did while researching it, do us a favor and hit that like button right now. It genuinely helps this channel reach more people and keep bringing you cases exactly like this one. Federal agents spent the better part of 18 months quietly building their case, working methodically to avoid tipping off the executives before they had enough evidence to move. They subpoenaed years of banking records. They interviewed dozens of current and former employees, many of whom were terrified of retaliation and only agreed to speak under strict confidentiality. They cross-referenced Medicare billing data, line by line, against actual patient charts, searching for the gap between what was billed and what had actually happened inside those facilities. Agents worked in shifts out of a nondescript office space rented under a different name, walls covered in whiteboards mapping out shell companies, wire transfers, and organizational charts connecting Willowbrook's executives to accounts scattered across multiple states. What they found was staggering. Over a 4-year period, Willowbrook's Senior Care Group allegedly submitted fraudulent claims totaling approximately $58 million. Investigators traced roughly $22 million of that figure directly to a shell company registered under the name of a close family member of one of the executives, a company that, on paper, provided consulting services to the nursing home chain. In reality, the company had no employees, no physical office, and no actual business function beyond receiving large, irregular wire transfers from Willowbrook's corporate accounts. From there, the money moved again and again through a chain of accounts designed to make it nearly impossible to trace without subpoena power. Some of it purchased real estate in a neighboring state. Some of it funded a private aircraft membership program. Investigators found luxury vehicle purchases registered to relatives with no independent source of income. They found a lake house purchased in cash. And in one detail that agents later described, almost in disbelief, as one of the most tone-deaf discoveries of the entire investigation, a 6-figure wine collection, cataloged and insured, all of it indirectly funded by a program meant to care for elderly Americans who could no longer care for themselves. Meanwhile, at the actual nursing facilities, families were reporting a very different reality: understaffing, delayed response times to call buttons that could go unanswered for 20-30 minutes at a time, patients left in soiled bedding for hours because there simply weren't enough aides on shift to attend to everyone. One family, interviewed anonymously during the investigation, described finding their father with an untreated bed sore that had gone unreported for nearly 2 weeks, a wound that eventually required hospitalization. A former nurse's aide, speaking to investigators, described entire wings of a facility staffed by 2 aides for over 30 residents on a night shift, a ratio she said made it physically impossible to give anyone real attention, let alone the kind of care being billed to Medicare. The very people the funding was supposed to protect were the ones suffering most, while executives siphoned resources meant for their care into private jets and wine cellars. This is the part of the story that turns a financial crime into something much darker. It isn't abstract numbers on a spreadsheet. It's real people, at their most vulnerable, being quietly neglected while the money meant for their care disappeared behind a wall of shell companies. As investigators dug deeper, they realized this wasn't isolated to a single facility. It was systemic, replicated almost identically across all 7 Willowbrook locations, as if someone had written a playbook and distributed it to every regional administrator. At one facility, an internal audit later obtained by investigators showed nearly 40% of residents were being billed for the highest possible therapy tier, despite the facility's own staffing logs showing only 2 licensed physical therapists on payroll, nowhere near enough to realistically provide that volume of care to that many residents. At another facility, in a different county entirely, the same exact pattern appeared, down to nearly identical language in internal memos about maximizing reimbursement categories. That consistency became one of the most damning pieces of circumstantial evidence in the entire case. Fraud that happens in one location can be written off as a local failure, a bad manager, an isolated lapse in judgment. Fraud that happens identically across 7 locations, hundreds of miles apart, points directly to a coordinated corporate strategy. Investigators eventually found the origin of that strategy, an internal training document distributed to regional administrators during a company-wide conference. that walked new hires through exactly how to classify patients into higher reimbursement tiers, using language carefully worded to avoid explicitly saying fraud, but that agents say left little doubt about its actual intent once cross-referenced with real patient outcomes. Former employees, speaking to investigators under condition of anonymity, described a workplace culture where hitting quarterly billing targets was treated as more important than patient outcomes. Staff who raised concerns were reassigned or quietly pushed out. Staff who met or exceeded billing targets were publicly praised in company-wide emails and, in at least one documented case, awarded a cash bonus explicitly tied to revenue per resident, a metric that had no clinical justification whatsoever in an industry meant to prioritize care over profit. By the time federal agents were finally ready to move, they had built what prosecutors would later describe as an airtight case. Search warrants were issued for Willowbrook's corporate headquarters, 3 of its largest nursing facilities, and the private residences of 2 senior executives believed to be at the center of the scheme. The operation was coordinated to happen simultaneously, at dawn, specifically to prevent anyone from destroying evidence or fleeing before agents could secure each location. FBI agents led the financial fraud components of the raid, executing search warrants for records, servers, and internal communications, while HSI agents focused specifically on the money laundering trail, seizing financial records, hard drives, and, according to court filings, moving quickly to freeze digital assets that investigators believed were being used to further obscure the flow of stolen funds. At the corporate office, agents say an executive assistant was caught mid-shred, physically feeding documents into a paper shredder as agents entered the building through a side entrance. That attempted destruction of evidence, ironically, became part of the case itself, an act of obstruction caught in real time, referenced later in the indictment as further proof of consciousness of guilt. At one of the nursing facilities, agents moved carefully through hallways still occupied by residents, coordinating quietly with on-site nursing staff to avoid disrupting morning medication rounds. 3 executives were taken into custody that morning without incident. A 4th, believed by investigators to be the architect behind the shell company network, was nowhere to be found at his residence. Agents later determined he had been tipped off just hours earlier. He was located 2 days after the initial raid, attempting to board an international flight under a legitimate passport, and was detained by federal agents before departure, just steps from the gate turn on notifications, because we're about to get into how this case actually played out in court, and trust me, you do not want to miss the ending. What made this case especially difficult for prosecutors wasn't proving that fraud had occurred. The paper trail by this point was overwhelming and largely undisputed. What made it difficult was proving intent, proving beyond reasonable doubt that this was a deliberate, coordinated scheme and not simply administrative chaos. Defense attorneys argued exactly that. They claimed the billing irregularities could be explained by understaffed compliance departments, an outdated and poorly maintained electronic records system, and honest confusion among overworked administrative staff trying to keep up with an aging patient population. They brought in their own expert witnesses, arguing that healthcare billing software of the era was notoriously prone to duplicate entries and coding errors, and that no single document proved anyone had acted with criminal intent. For weeks, the trial seemed like it might hinge on exactly that argument. And then prosecutors introduced a single piece of evidence that changed the entire tone of the courtroom. It was an internal email sent by one of the executives directly to the billing department, instructing staff, in writing, to maximize therapy minutes across all residents regardless of documented need, specifically in order to hit quarterly revenue targets set by corporate leadership. It was the smoking gun investigators had been searching for since the very beginning. Intent, laid out in black and white, sent from a verified corporate email account, time-stamped, archived, and preserved exactly as it had been written years earlier, long before anyone at Willowbrook imagined federal agents would ever read it. From that point forward, the case moved quickly. 2 of the 4 executives accepted plea agreements, agreeing to cooperate fully with prosecutors in exchange for reduced sentencing recommendations. Their testimony corroborated the whistleblower's original claims in painstaking detail and provided investigators with additional insight into exactly how the shell company network had been structured to launder the stolen funds. The remaining 2 executives, including the one who had sent the incriminating email, chose to fight the charges at trial rather than negotiate. It did not go well for them. After 11 days of testimony, including detailed forensic accounting presentations and emotional statements from former employees and family members of residents, a jury returned a verdict of guilty on all major counts, including healthcare fraud, wire fraud, and conspiracy to commit money laundering. In the sentencing phase, prosecutors made a deliberate choice not to focus solely on the dollar amount involved. Instead, they centered their arguments on the human cost of the scheme, the neglected patients, the families who had trusted Willowbrook with the final years of their parents' and grandparents' lives, the broader erosion of public trust in a system that millions of elderly Americans depend on every single day. The lead executive received a lengthy federal prison sentence, along with a court order to forfeit assets directly connected to the fraud, including the lake house, the private aircraft membership, and the wine collection investigators had flagged during their initial financial trace years earlier. Combined, the seized assets amounted to just over $31 million, a significant fraction of what was originally stolen, and a meaningful step toward restitution for the federal program that had been defrauded. In the sentencing phase, prosecutors made a deliberate choice not to focus solely on the dollar amount involved. Instead, they centered their arguments on the human cost of the scheme, the neglected patients, the families who had trusted Willowbrook with the final years of their parents' and grandparents' lives, the broader erosion of public trust in a system that millions of elderly Americans depend on every single day. The lead executive received a lengthy federal prison sentence, along with a court order to forfeit assets directly connected to the fraud, including the lake house, the private aircraft membership, and the wine collection investigators had flagged during their initial financial trace years earlier. Combined, the seized assets amounted to just over $31 million, a significant fraction of what was originally stolen, and a meaningful step toward restitution for the federal program that had been defrauded. Cases like this one are exactly why we started this channel. Not to sensationalize what happens to vulnerable people, but to document it clearly, honestly, and in detail. Real federal cases, documented facts, no noise. If this story made you angry, made you think twice about a healthcare provider you trust, or made you want to check in on an elderly relative today, that reaction is exactly why this story needed to be told in the first place. Make sure that bell icon next to the subscribe button is switched on, because we post new cases regularly, and without that notification, you will absolutely miss the next one. Thank you for watching all the way to the end. We'll see you in the next case.